There's a procedure called Deep Brain Stimulation, or DBS for short. It involves implanting 1 to 2 tiny electrodes into very specific areas of the brain to treat neurological conditions. And those would include dystonia, certain types of epilepsy, as well as obsessive compulsive disorder. Deep brain stimulation is not a very new technology, as it's been used in adults extensively for multiple decades, but its application in children is underutilized. There are many children with similar neurological conditions that would have great benefit from deep brain stimulation, but there isn't a lot of ability to perform this in most parts of the country. I'm very excited to bring that ability here to Orlando Health and provide the full spectrum of minimally invasive neurosurgical procedures. So DBS surgery is an elective surgery. We bring your child back, put them to sleep under general anesthesia, and make 2 small incisions behind the hairline. These incisions allow us to make tiny holes in the skull and implant a small electrode into 1 or 2 areas, depending on what we're trying to treat. Those wires then connect to an internal battery that's implanted in the chest, similar to where a pacemaker would be. Once your child's incisions heal up, hair grows back, there won't be any evidence that there's any implant at all. After surgery, once your child recovers, we work very closely with our neurology colleagues and our medical device colleagues to program and set the device to the optimal setting to allow us for the best result. Now, depending what the condition is, you can see treatment benefit very quickly, or it can take a matter of months. In fact, in some cases, the full benefits actually grow over the first couple of years. One particular condition where deep brain stimulation in children is wonderfully effective is what we call primary dystonia. This can be very life-changing in a child's ability to move independently, to use their hands for normal function, their legs for normal function. We had a patient recently who was a teenager. She was a junior in high school, and she underwent deep brain stimulation for primary dystonia, and she's done remarkably well. She is having a much easier time at school as far as writing. She's still able to do many of the things that she loves. A patient with dystonia will still have dystonia, but it will be dramatically improved, and this has provided a now multiple year-long effect. Here at Orlando Health, we have both the technology and the expertise to provide the highest level DBS surgery implant for your child, available only at the top medical centers around the world.